It's every surgeon's dream to be able to control the tissue. We know that some patients are very healthy. Their skin and muscle and fascia and collagen is very good, and we know we're going to get a good surgical result. Unfortunately, most patients aren't so fortunate, and so if we could control the tissues, if we could engineer the tissues to be more desirable, then we could control our outcomes across the board for everyone.
TIGR is approved by the FDA for reinforcement of soft tissue where weakness exists. So as a plastic surgeon, I'm constantly looking for those uses, and I'm constantly being presented with where we have soft tissue defects.
I have no belief that one thing's better than another. My belief lies in measuring the data, measuring the outcomes, and learning from that, improving value. So when a company comes and they have a product that they think has value, we'll assess it to see if there's a potential to improve value of the patient. And in Novus's case, we saw the potential. We saw what we were using, the cost, and we saw the technology, and we saw implementing this in some patient processes could improve value. And we're seeing that in the data.
When I first heard that TIGR Matrix had come out, I immediately began using it, and I never went back to using the old materials again, because I loved the way it allowed me to control the tissue and add strength to otherwise unhealthy weak tissue. When I put it in, it feels like a dress shirt. In a month, it's as soft as a silk nightgown. And as a surgeon, to be able to use a fabric that's so responsive and forgiving as opposed to stiff, it's easier for me in the OR. The patients can't feel it, and I don't worry that the matrix will injure, say, a breast implant or tissue.
That dynamic aspect is what I like about TIGR. It doesn't give you a stiff reconstruction. It gives you support, but there's dynamic. It allows for change, it allows for tissue ingrowth that the other products really don't have.